Our drug that we researched was ecstasy. Ecstasy is a stimulatory hallucinogen, which means that it speeds up body functions and causes an alter of perception.
The behavioral effects are happy, energized, euphoria, and a want for touch.
Ecstasy causes a release of large amounts of serotonin and blocks reuptake. Therefore, when the serotonin is gone, people feel an extreme low. This can lead to abuse because people want more so that they feel happy, energized, and a want for touch. It can damage neurotransmitters too, so they can get depressed. It can prevent sweating, but it also causes dehydration, which can result in drowning of oneself because they drink too much water and the cells can burst. Also, because it is a stimulant, it increases heart rate and breathing.
This picture shows the effects of ecstasy versus one without ecstasy. As you can see, without ecstasy, there is some serotonin in the synaptic gap and some in the vesicles. With ecstasy, almost all the serotonin is in the synaptic gap and firing the receptors. However, there is not much in the vesicles. When the ecstasy wears off and the serotonin is used up, there is not much serotonin left in the vesicles to fire the neurotransmitters and result in a normal happiness that people feel. As you can see, without ecstasy, there's a lot of serotonin present in the neurons. After ecstasy, and it is all used up, there's no serotonin, which can lead to depression and negative effects. 7 years after ecstasy, some serotonin is restored. However, there is less than without ecstasy ever used.
The therapeutic uses for ecstasy are: ecstasy users are attracted to the drug by the warmth and empathetic feelings it induces, and by the energy provided by the stimulant effects on the drug. Ecstasy is a pain reliever. During therapy sessions, treatment-resistant post-traumatic stress disorder or people with PTSD are administered ecstasy to help break down mental barriers to allow them to discuss painful events during their therapy session, which they normally could not discuss. It is also used for people who suffer from terminal illness. Use ecstasy to supplement therapy sessions to help them cope and come to terms with the impending end of their lives. As you can see, ecstasy has a lot less emergency room visits than, for example, cocaine, marijuana, benzos, and heroin.
When all the serotonin is used up in the synaptic gap, there is not much serotonin left, which can lead to depression. Also, ecstasy on the streets is less than 10% pure ecstasy, which means that it can damage patients because there are additives that can affect them that are other than ecstasy. Also, because ecstasy causes an increased heart rate, patients with heart disease can result in heart attacks or heart failure. Also, as patients use more ecstasy, there are more negative effects rather than more positive effects of it. People can have a psychological dependence on ecstasy and feel that they need it